Yes. Yeah, you are ready now. You
Okay.
can start the session. Yeah. My
I said,
name
what's the name
is
of the? Okay.
my name is Abraham Lincoln and I'm 25 years old. Yeah, you can start now.
Good morning, Mr. Abraham Lincoln. Is it all
Yeah,
right? Like, what name do you prefer me to call you? Are you okay with Abraham or Mr. Lincoln?
yeah, you can call me Mr. Lincoln.
Oh, Mr. Lincoln, good morning. I am one of the nurses that will be supporting you this morning. My name is Dorcas, and I understand you are scheduled for a minor surgery. And before we go through some of the preparation that's about the surgery, will it be all right if you talk to me about how you are feeling this morning?
Yeah, actually I am in pain nurse. I am in pain and I'm
Okay,
embarrassed about the problem.
okay. Oh, all right. I completely understand how you are feeling, and I want to reassure you that you are not alone. Uh, Many patients feel the same way that you feel about their condition, but please remember that the doctors and the nurses are here to support you, and we go through a wide range of issues, conditions, medical conditions. So it's absolutely right if you are feeling this way, but be rest assured that we are here to support you and to ensure your comfort, your comfortability. Is that okay?
Yeah, of course, nurse. I want to tell you, I feel that I'm very weak because of this
Okay.
ailment, because of this problem. I need
Okay.
painkillers more often than I take them.
Oh, all right. I understand your concern, but let me tell you more that taking pain relief isn't a sign of weakness or you are not up to the task. It's just a way of relieving your pains. A part of it's part of a recovery for you. So when pain is well managed, you feel more comfortable, you feel more better, and we are here to ensure that your comfortability is our priority, that you are not going through pain and you are well managed. So just to let you know that taking pain relieving drugs is not part of analgesic is not part of being a sign of weakness, but just to aid in your recovery process.
Yeah, I am very much embarrassed to a large extent. And then I did not pay attention to the doctor when he was explaining me what a
Okay.
pilonidal sinus is, and I want to know about it. Is there any other way? Can I still find out what a pilonidal sinus actually is?
Of course you can. Yes, you can. Just to explain to you further, pilonidal sinuses is a small opening that it shows under the skin, and the tract on the surface of the skin, and is caused by an ingrowth of hair. It often contains hair and uh, hair, and it's usually caused by ingrowth of hair. It's not due, just to let you know that it's not due to poor hygiene or not taking care of your body very well, but it's just a common kind of a symptom for that is more particular among people that sweat a lot and they have a prolonged sitting. So this is just what causes the pilonidal sinuses.
Yeah, fine. I want to tell you, I am very clean and neat and tidy. But the thing is, due to my work, I shower only in the morning and I have a
Okay.
bath at night.
All right. That's very good of you. As I said earlier on, it is not due to poor hygiene. I still emphasizing that it's not due to poor hygiene. It's just common with people that sweat a lot and sit for a long period of time.
Yeah, what have I to do after the procedure?
That's a good question you're asking. After the surgery, we are going to give you clear instruction on how you need to manage the wound, and taking warm bath. You can also take a shower. You advise to ensure that, just to ensure that the area is kept clean, and this will promote healing. Um, and also show that it's also very important for you to look out for signs that could that might not allow the wound to heal properly. Signs like if you experience signs like increase in redness, you can if there's any sign of swelling, if you see any sign of discharges, if you are feeling feverish, this could indicate signs of infection. And before you leave, we'll give you some dressings that you can use, and I'll explain to you further on how you can ensure that the place is always kept clean and dry. This will promote proper healing of the wound. And again, also you'll be given some medications to help in the healing of the wound, and also to ensure that there won't be any um, breakdown during the wound healing process.
All right. I confirm and I make sure, or I ensure you that I am going to follow all the doctor's suggestions and the nursing
Okay.
staff's advice when I'm
Oh,
in the
that's very good.
hospital. And I will
Okay.
also stick to the medication regime. I don't
Right.
want to suffer pain, so it's my health altogether. So I'll take care. I'll take all the precautions, nurse.
Oh, that's good. I'm really glad to hear that. We are here to support you in every step of your healing process. And if you have any worries, any concerns, or you have any questions before and after the procedure, don't hesitate to reach out to us, and we are here to guide you through the step by step of this of the surgery, and after the and the post surgery, to ensure that your healing process goes on smoothly. Thank you,
That's
Mr. Lincoln.
that's
Thanks for
really
allowing me to have a conversation with you.
thank you very much, nurse. That's really wonderful. Thanks once again.
You're welcome.
Yeah. Now coming to the point, I want to tell you some things. At the beginning, you were little not very ready, not 100%, but afterwards you gained the momentum and you improved the quality. And in between also, there were some quite often there were some pauses as if you got stuck in between, and you are thinking for 1 or 2 seconds. You're taking time to analyze your viewpoint. So this is called a preparation. Okay, you are preparing mind. So you have to go ahead. There should not be breaks and pauses. Too many.
Okay.
Of course, it's okay. It's not. Um, yeah, so that shows the other person that you're not mentally ready. It gives a clear picture. So you can do some common frames, or generalized structures called fillers. Okay, fillers, you can say. Like you can say, first and foremost, that's absolutely right. I agree with your opinion. To speak frankly, the most important thing is, so like this you can take the fillers and you can put there when you are getting stuck. Okay, so try to see what fits best. that's a f-
Okay.
uh, that's the fact. The matter of fact is, so you can some generalized statements. So they add value, and at the same time they work as fillers. Some gap fillers we call that. Very term is fillers. When we don't know something, suddenly you can just throw those words there to fill in the gap. In the meantime, you'll get time and your mind will process and you can go ahead with your speech. That's the point. So try to learn some fillers and use them on a daily basis. Practice them.
Okay.
The next one, whenever you are speaking, there are three modes, okay, of operation. Three modes of operation. Modus operandi. So three modes of operation. Now, what are these three modes? First thing is, most people imagine that it is an examination and you are an examinee and I am an examiner. Most people think like that. We can say 50% of the people think that this is a test. I am being tested and the other person is the testing. So the examiner, I am the examiner, and you, Dorcas, is the examinee, and this is an examination. This is one mode of thinking. When you think like this, you become weak, and I become stronger because I am the examiner and I am the stronger person, and you are the weaker person because you are under pressure, because you are taking an examination, you'll be under pressure. So, this is not the right mode. Remember, do you understand,
Yes.
Dorcas? Right.
Yeah, I'm listening.
Number two, the second mode is you'll imagine yourself as a student and me as a teacher. You are a student and I am a teacher. So you again become weak because the teacher is the stronger one and you are the weaker one because teacher knows more than the student. This is the second version. Many people say 40% of the people see like they are students and the other person is a teacher. So you put yourself in a weaker stance or position and give the power to the domination to the other person. You imagine the other person as the strongest. So this version is equally harmful. This is called the suicidal attempt. You're killing yourself. You're draining your brain. You are going diminishing, pulling yourself down by putting in the weaker person's shoes and imagining the other person as a devil or a demon or a powerful person, and you are very weak. So you become weak. You pull yourself down. So both of these versions are wrong. Now, now what it is, the third version that makes more prominent. You have to imagine yourself as a nurse and me as a patient because this is a role play. This is not an exam. Remember, this is a role play. Don't imagine yourself as an examinee or a test taker. Don't put yourself in the role of a student. Here, you are playing the role of a nurse. You are a nurse. You are a nurse. So put yourself in the role as a nurse. Remember that. Okay. Put yourself in
Okay.
the role of a nurse. Then what happens? The other person is a patient. Patient is afraid. Patient is helpless. Patient is, he's very weak. So you are the provider and the patient is the receiver. So I am in the receiving end. You are in the providing end. Now you are very powerful. You're very strong. So many people don't see through this third angle. You have to stand straight. You have to not show the face. You should not show the tail also. Your coin, which is standing straight. Only 1% of the students follow this pattern. You are the nurse. You are powerful. The other person doesn't know anything about what the condition. Pilonidal sinus. I don't know anything about it. I'm on ground zero. I'm at the very basis. I'm at the foundation. But you are at the pinnacle. You're at the top. You have everything, every minute detail regarding what a pilonidal sinus is. Mind you. Now, which side you want to take? You want to go to the examinee side or you want to go to the student side? Examinee side is the last stage where you are sitting in the examination and the real test is going. That one particular day, that particular 5 minutes, only you have to be an examinee. And the student, throughout you are a student, throughout your student. But whether in the examination or in the practice, you are a nurse. Remember that. You are a nurse. When learning, you be a student. But when you are playing the role play, you are a nurse. Before you are a student, after you are a student. But you are a nurse. Strengthen yourself with this powerful strategy. Otherwise, you'll be a loser. That's what many people lose their grounds. Otherwise, everyone will get a 400 plus. Remember that. Because I don't know anything about it. I am helpless. I'm asking you. I'm literally begging you. I don't know. Can you please? Can you please? Can you please? I don't know anything about that particular situation. I was embarrassed and I did not know what I should do. I was confused. Doctor told me everything, but I was not able to understand. I was not in a situation. I was very helpless that time. Now also I'm helpless. Now I want to know. Can you please? I'm literally begging you. I want to know everything about what a pilonidal sinus is. Can you please help me, nurse? It's a literally pitiable situation I am. So you are the strongest. You know everything. So you are in the persons, you are in the givers, you are in the providers, you are in the upper hand, which is dropping wisdom, what a pilonidal sinus is to a particular patient, Mr. Abraham Lincoln. This is the power. This is the secret. Do you understand, Dorcas?
I'm listening, yeah.
Yeah. Now tell me, did you get a breakthrough of how your approach should be strong or weak? You turn to the left side, you see with the right eye, you only see half. You see with the left eye, you only see half. You see with both eyes straight. You see with the, you close your left eye and see with the right eye, you can see only the right side. You see, you close the right eye and open the left eye, you can see only the left half. But if you open your eyes, you can see the 180-degree angle. You understand now?
Yeah.
That's it. You are powerful. Now tell me, I gave you a lot of information. You have a lot of subject. You have good vocabulary. You have wonderful grammar. There were not too many mistakes, and everything is fine. But the thing is, the panic, the confusion, which is playing a havoc in your role play. Don't give it a chance. Is that clear? Now tell me, what benefit did you gain from this session, feedback session?
Well, it has given me just for me to practice and learn how to use a lot of fillers to be able to fill in the areas that I'm trying to get more information or trying to explain further to the patient, to reduce those and reduce it and ensure that I'm able to use a lot of fillers for me to gain my momentum to explain the concerns or the questions that the patient is asking.
All right, that's very good. Thank you very much. So, see you in the next session.
Okay.